Okay, go.
Now this sound meant that someone needs to save his life by help of others. This may mean that up to 50 units of donor blood are needed to save him. Needless to remind you that someone might be your loved person, or even you. And now if you're struggling the urge to Google where to donate blood in your Technopole at Sunday, or trying to put this down your 20 pages long to-do list, we're here to help you. We know it's hard to track and find the time and place to donate blood. My name is Vitali and we're Donated. What we have done in Garage48 for 48 hours is we have developed and designed a system that will resolve this situation. We have built an app for Windows Phone 8 and iOS and built a backend on Microsoft Azure. During this time, we have also outreached to the media. We've gathered 250 likes on our Facebook page. We have been pat on the head by Estonian Blood Center. We have even reached out to the president of Estonia, who retweeted our post. And thanks to that, American Red Cross is interested in us. The people we've talked to, we've received feedback from regular donors and doctors who are interested. People after talking to us who are interested in donating blood. One of these people is sitting here. It's Arctic Startup CEO Dmitry Sarle, who wanted to go home and donate because he spoke to us. Now, the app itself is a social app. It will not only give you a track of where have you donated, when have you donated, when can you donate next time. It will tell you where can you go, what is the situation with the blood stocks of the Estonian Blood Center. Our marketing plan is quite simple. Every donor has a fixed price for the donation center. Depends on the season, because they have to spend money on marketing to acquire the donor and keep them donating. So acquisition and retention is what we're targeting. I'm not mentioning procedural costs, but if we prove them that we can cut their marketing costs, they will come to us and work with us on cost per acquisition conditions. That's our first step. Then we want to go out in the world and start, let's say, Finland, because they do have a centralized information system. We don't know the numbers, what we can earn, and how we can earn. We know who we target. Our end users are people like you who are conscious enough to go and donate blood and tell their friends. More of all, they will receive feedback from the app and awards. Thank you. This has been Vitali from Donated. 10 people passionate enough to save lives, save time, save lives. Thank you.
Thank you. Looks like a really good idea. So any questions? If no questions for start, when do you think you could go live with this Verekeskus in Tallinn?
Of course, the first business day, tomorrow.
Okay, so basically for them it's pretty easy, or how would they work with you? Do they need a technical integration, or they just come to your site and send out messages, or how does it work?
Let's start with the situation that it is right now. Our application through our backend parses hard-codedly the blood stocks of Estonian Blood Center. The person using the app will get notification about his blood group and other blood groups and can socialize it by sharing. But we don't know yet if the governmental institutions, including the blood center themselves, allow us in their database yet. But in an ideal condition, we don't even need it, because this is mostly a social app. If we get too much stuck with legal stuff, then we let it go, but it will still be useful, even what we have right now.
So basically you take the public data of available blood and you push that away to your users?
Yes, that's true.
Okay, good.
Well, you convinced me to use it by talking to me, but then how do you convince more people to donate it through the app? Like you said, there's awards, or like basically how do you make it cheaper for Verekeskus to get people through your app versus how they do it right now?
Thank you very much for the question. This is in progress right now. We're reaching out to media, telling people about us. That's already a start, that's already a base. Then we will need to talk to different companies who want to build an image in altruistic and healthcare and build affiliate marketing with them. If they want to support this, they can provide some freebies to our users. Freebies like attendance to events, support or services. And if the people like it, then of course they'll come. Not only the blood center gets their blood, people get services and service providers get money because people will most likely come back to them. So it's a very wide model. We can't say anything right now, but we'll try to reach out to these companies.
Okay, thank you very much. I'm looking forward to see this app on other platforms as well. So, but the idea is great.
Well, it's all in the future. Android, web platform, and probably, of course, Windows 8.
Okay, thank you. Give a big applause.